Hello, we're Madison Hassell's audience.
Yes, Madison's audience.
This is Alex Smith. He died this year at the age of 26 because he couldn't afford his insulin in America. He made $35,000 a year as a restaurant manager, but he couldn't afford his $450 a month health insurance with a $7,600 out-of-pocket deductible. The insulin he needed for diabetes was $1,300 a month. When he turned 26, he was kicked off his mom's insurance, so he had to start rationing his insulin. So he died a month later from diabetic ketoacidosis. According to Right Care Alliance, insulin only costs a few dollars to make. Today I'm going to discuss the uninsured and the underinsured, the family struggle to pay for medical bills, and a nonprofit organization called Ascension who is fighting to help the most vulnerable people in the need of medical attention in the United States. First, let's talk about the uninsured and the underinsured populations. According to Census.gov, 27.5 million people are uninsured in America. And according to Crash Course Sociology, they are more likely to postpone medical care with a worse continuity of care. It's associated with needing more expensive and urgent medical procedures because they put it off until they are literally, dying. And according to the Kaiser Family Foundation, most of these uninsured Americans are low-income families, with 72% having at least one full-time worker and people of color being the most at risk for being uninsured. So, according to the Kaiser Family Foundation, these are some of the reasons that uninsured people don't want to get insurance. The cost, 45% saying that the cost was too high, and 21% saying that they lost their job or changed employers, so they lost their private insurance. Now I will talk about the underinsured Americans. According to Crash Course Sociology, 56% have private insurance, which means that they get their insurance from their employer. So what about the other 44%? Well, the other 44% have insurance, but they're usually self-paying, which can result in higher costs. And so whenever they're self-paying, they usually want a low-cost insurance because that's all they can afford. So they usually end up paying low premiums, but they don't realize that ends up being higher out-of-pocket expenses whenever they do have an emergency that causes them to get a medical bill. Even though they're insured, it ends up being a lot. And most underinsured Americans are blue-collar and low-income jobs that are less likely to provide private insurance. So that includes self-employed people and people with small businesses that maybe don't have private insurance yet. So this just shows that people that are insured still have the same worries as people that are uninsured. Now I will talk about the struggle to pay for these medical bills. According to the Wall Street Journal on YouTube, 26% of households couldn't afford to pay their medical bills, whether they were insured or not. 52% of the debt collection were medical debts, and they were responsible for half the bankruptcies in 2016. According to Debt.org, there was an average of $10,000 each consumer a year for medical bills. That's 50% more than other consumers in other countries. Now I will talk about surprise medical bills. No one knows when they will get sick, so nobody knows how much to put aside for emergencies. So there's something called in-networking, where you go to a hospital or healthcare provider that accepts your insurance. So you go in there expecting to not pay the full price. And then there's out-networking, where you go to a doctor or healthcare provider that doesn't accept your medical bill, your insurance, so you have to end up paying the full price. And there's something called a balance bill that a lot of doctors do, where it'll bill the patient for the difference between a bill charge and the healthcare's allowed amount. So an example of this is, let's just say you broke a bone and you need an x-ray. So you do your research and go to a hospital that you think accepts your insurance. So you go in there thinking that you're not going to pay a lot. But the doctor who reads your x-ray is out of network from your insurance. So you end up with a really expensive medical bill. So that's where they get the surprise, because you don't know that it's coming. And these are just some common reasons for surprise medical bills, some including out-of-network care in an in-network hospital and out-of-network ER care. So emergencies, you never know. Now I will talk about my nonprofit organization called Ascension. They are a Catholic-based healthcare system in America. Their mission is for the generosity of spirit, and especially for persons most in need. They provide high-quality, low-cost health care to the people who need it the most. And they are one of the leading nonprofit organizations in Catholic health systems in the United States. And these are just some stats that came straight from their website. They raised over $2 billion in 2019 for in care of persons living in poverty in the community benefit programs. They have over 40,000 aligned providers, and they have 2,600 plus sites of care in 20 different states. And these are just some states that they are in. Obviously, there are a lot more things regarding to the healthcare system in the U.S. that I was not able to discuss in the allotted time that I had. But I was able to talk about the uninsured and the underinsured, the struggle that families have to pay medical bills, and how a nonprofit organization called Ascension is helping this crisis. Thank you for listening to my speech.